Welcome to As a Woman, Fertility Hormones and Beyond. I'm your host, Dr. Natalie Crawford, and I am a board-certified OBGYN and fertility physician, and also co-founder of Fora Fertility in Austin, Texas. Each week on this podcast, I discuss health and fertility and how they relate to your true self. Become a part of the community of collaboration that amplifies others as a woman. I hope you enjoy the episode. Hello and welcome back to the As a Woman podcast. I'm your host, Dr. Natalie Crawford, and today we're talking all about donor options for conception, specifically egg and embryo donation. I'm a board-certified OBGYN and fertility doctor, and every single day I talk to patients about what they need to know to try to get pregnant. And sometimes this journey reaches a place that maybe isn't our plan A, and we have to start looking at other options. Similarly, some patients come knowing that they're going to use donor eggs or need donor eggs or very interested in donor embryos. And these are all really different ways to have a family. They're all very, very beautiful. And every clinic will do them a little bit differently. So this is a circumstance where it is really important for you to understand what you're looking for, what's important to you, and what clinics offer this in different ways. A reminder, there's no judgment when it comes to topics like this. Growing your family is a personal decision. I always ask my patients to step back and be open-minded. That doesn't mean you have to do all of these things, but you owe it to yourself to learn about them and to understand what each option may be so that you are in a position of power and ultimately you're the one making your decision for the future, not having time or other people's opinions make that decision for you. With that being said, I practice at Fora Fertility in Austin, Texas. We do things one way, other clinics do them another way. We are formally launching an embryo donation program called Embryos, and I will talk about it in this episode. Embryo donation is highly complex. You might hear it talked about as embryo adoption. And if that's something you're interested in, definitely make sure you're still here in the second part. But I'm so excited to have Embryos opening. Truly, this has been a passion project of mine and something that I've always felt like was a really big need in our field, trying to help patients who want to give their embryos a chance, but maybe not in their own family, and trying to help patients who are in positions where they're not able to conceive with their own genetics for one reason or another. Quick reminder that we loved answering your questions. So every week you can ask questions and we will answer them. Some questions can be asked on Instagram at nataliecrawfordmd every single Monday. Those questions will be answered here in some podcast episodes, in the weekly newsletter, and on Instagram itself. You can also sign up for the newsletter at nataliecrawfordmd.com/newsletter. And we'll have special goodies, a TTC Starter Guide, recipes, and some really exciting things planned for the newsletter community. But you will also be able to get your questions answered as well and some exclusives. And you can call 657-229-3672. That is the voicemail for this podcast. Currently recording a lot of these episodes for the holidays, so call and ask your question. And then follow along on YouTube at Natalie Crawford MD. We are starting lives, which we had one last week and it was phenomenal. So really love answering your questions in real time and getting some of the follow-up that you might have immediately after. All right, I'm going to dive in and we're going to start with egg donation and then embryo donation. Terminology basics. If you're coming into this, it's okay if there's a lot you don't know. Egg is what grows inside a follicle inside the ovaries in a normal month. A woman would have one egg that would grow to maturity and ovulate. The rest of the eggs that were available that month would die off, and the next month she has another group. When you're doing egg freezing in contrast or IVF, our goal is to get all of the eggs outside the vault to grow. When they get to maturity, we can take them out in a process called an egg retrieval. So when you hear about people talking about IVF or egg freezing and they're talking about growing their eggs, this is what they are doing, using these hormones for a couple weeks, hormone shots. These are shots of the same hormones that come from the brain that get eggs to grow naturally, just in much higher doses. And then a quick surgical procedure to take those eggs out of the body. When you are going through IVF or egg freezing yourself, your success is limited by number one, how many eggs you can get, number two, how old you are, or the genetic normalcy of your eggs. And we'll say number three, if you carry any known genetic diseases or translocations, this can make finding normal embryos even more difficult. IVF is clearly correlated with age. So even if we wind back the clock to before the time period when we had genetic testing, you can see that age at time of IVF is the number one predictor of your opportunity for success. What we know more now is that there's also strength in numbers. So the more eggs you have at a younger age, the easier the process will be. This just gets tough when you get older. If you are an average 40-year-old, you might have about 8 to 10 eggs available in a given month. Very average, that's fine. But of these eggs, only about 25% of them are going to be genetically normal. And we have to remember, not every egg is going to be mature, fertilize, grow to an implantation stage embryo. Of the ones that do, 25% of those will be normal. And then a single genetically normal embryo has a 65% chance of success. And if you're sitting here walking through this math and you're 40, and let's say we get 10 eggs and we fall very normally, this is what we would see. You have 10 eggs available in a given month. You might go through IVF and you get 10 eggs to grow. You take those 10 eggs out of your body. If they're all mature, best case scenario, now you're going to go fertilize them, and we tend to see 75 to 80% fertilized. So now we have 8. You let those grow out to an implantation stage embryo called a blastocyst, which is a day 5 or 6 embryo. The embryo is very sturdy and structurally sound at this point, can be tested for genetics, frozen and thawed with over a 99% survival rate. Half of the fertilized eggs will make it to this stage. So in this example, we're now at 4. If we do genetic testing, we would then expect 1 out of the 4 to be normal. This is based on age. If we were 30, we would have very different math. We'd have 3 out of the 4 normal. So because of our age, we can see such a huge difference. Also, an average 30-year-old would have closer to 20 eggs. So that example might be 20 eggs retrieved at age 30, 16 fertilized, 8 that grow through, and then 6 out of 8 normal. So at 30, if you're an average 30-year-old, you're going to get 6 normal embryos, and an average 40-year-old is going to get 1. And of course, average by definition means some people do better and some people do worse. This is just highlighting that it is not impossible to get pregnant as you're older, but it's certainly harder. And even with IVF, even with this amazing technology that we have, we do not see 100% success rates. So a single genetically normal embryo is going to have a 65% chance of live birth. If you're 40, you just have 1 to transfer. If it doesn't work, which 65 is not 100, now we got to start the process all over again. IVF can be really expensive. One cycle of IVF is easily $20,000 to $25,000, and that's not including an embryo transfer. So you can see that you'll have to do multiple cycles at an older age to get on average what somebody younger could get. That's why you hear everybody talking about testing your fertility and egg freezing and doing what you can at a younger age, which is great for younger patients. But if you're at the age of 40 already and this is where you are, we can't rewind the clock. And it's not your fault that you didn't get pregnant earlier or you didn't try. There are so many extremely valid reasons for delaying starting your family, but that doesn't mean that you're any less worthy of having that family. I think it's really important to hear that so many more people use donor eggs or embryos to conceive than you know. People do not talk about it. Celebrities do not talk about it. And even in the example I just gave you, many people will look at the money, the math, the odds, and say, I'm not sure we want to spend $50,000, $60,000, $70,000 to do this if it could be done in a more effective way, a faster way, using donor eggs. And what I mean by that is that some people could potentially still get pregnant on their own or still have eggs remaining. It's not just all women in menopause who are using donor egg. Sometimes it just makes the best sense. Sometimes you might have failed cycles behind you. Sometimes it's just the odds don't make sense. Sometimes it might be that you're past the age requirement of your clinic and they no longer do IVF using your own eggs. And that's just due to the very, very low success rates once you pass certain ages. That age is going to vary clinic to clinic, tends to be somewhere between age 42 to 45. And that's just because the odds of finding something normal becomes so low that ethically it's a big question mark. If you're really using somebody's resources, time, emotional, physical, money wisely, and it might just be a better option for them to do something else. Every situation is unique, so I think that's really, really important to state. But what I'm starting at is that IVF doesn't work for everybody. You might be listening to this episode saying this is never going to be you. And we just had our Fora baby party, our gathering, and it's so incredible to see so many children who exist because their parents didn't give up, and so many of them do not share their parents' genetics in some way or fashion. I think that's really important for you to hear, that what we call third-party reproduction, having an egg donor or a sperm donor or an embryo donor, or somebody who couldn't carry their baby, they had a gestational carrier. These things are so much more common than you know. They feel isolating, but they're more common than you know. Reasons why somebody turns to an egg donor. So number one, you are out of eggs. This could be you're in menopause or premature ovarian failure. I've diagnosed a patient as young as 16 in premature ovarian failure. So do not think that only old people use donor eggs. You also can have just advanced maternal age. So maybe the math equation I just walked you through doesn't make sense for your family or your circumstance. So people who are not in ovarian failure, but who it makes more sense. Also patients who carry a maternal disease, potentially, whether it is a genetic disease, a cancer-carrying gene, a mitochondrial disease, could be a balanced translocation, but potentially something genetic that they don't want to test out. They'd rather just use a donor egg, or it's unable to be tested out and they feel like a donor egg road may be a safer option. We also have people who've had surgery and who've had to have their ovaries removed in the past, or patients who safely can't go through egg retrieval potentially, but need IVF. Anybody who's going to need a gestational carrier. So if you can't carry a baby, let's say if you've had cancer in the past, you also may not be able to go through an egg retrieval depending on the type of treatment you're on, especially if you're in the midst of cancer treatment. So it might be a scenario where you need to go down an egg donor road. And then you also have other couples or families. So if you're a single man or a gay couple, obviously they're going to need an egg source. And just for clarity's sake, we don't support, it's not recommended that people do what's called traditional surrogacy. The word surrogate is still used in common language, but traditional surrogacy is where one single woman both carries the baby and it's her eggs. Typically, she's inseminated with one of the intended parents' sperm, or it could be a more, quote, traditional means of conception. But there's some real logistical challenges with that. And so for couples, like if there's a gay couple and they want to have a child, they usually need to find an egg donor and then a separate person who is going to carry this pregnancy for them. In short, that can be really expensive. So understanding the different options is really important here. Basic options when it comes to egg donation. So if you are going to use eggs, these are vast majority of the time from an anonymous egg donor. But I think it's important to know they could be from a directed egg donor. Typically, these are cases where it might be a sibling. So if I have somebody who went into ovarian failure early or lost her ovaries, maybe her sister has eggs, is done completing her family, and would like to donate them directly, that can be accomplished. Honestly, it's often more expensive because you have to cover the cost of all of the FDA testing. I run the third-party program for us at our clinic, and so it is so much work. The FDA has to come in and inspect. There's a lot of paperwork. There's a lot of nuance, certain blood tests, certain physical exam. Things have to be done in a very peculiar way. And so that screening is split amongst multiple donors if you're using an egg bank or a sperm bank if we were talking about sperm. But if your sister is donating you eggs, you still have to go through the same process, but you yourself are funding all of that FDA required testing. So that's one thing. People often think, oh, it'll be cheaper to use my sister. And even though she's not getting directly compensated as a donor, it may not actually be any cheaper. You also have to have a more specific legal agreement, psych evaluation for known donors, and in the context of going through an agency or a donor bank, these things have already been taken care of before you're even seeing your options for the donor. So requirements include a physical exam, blood work, screening history, screening questionnaire. You have to have testing for ovarian reserve. You have to have psychological evaluation, genetic testing, and if it's a known donor, you'll have to have a legal agreement, as I said. So it adds up. When you're looking at anonymous donation, because we're going to assume that's what most people are doing, non-directed, so somebody you do not know. Two big concepts here are going to be frozen egg banks or a fresh donation. So in a fresh donation, you are going to get all of the eggs that this donor has. It is typically more expensive because this one donor is going through the cycle, and whatever eggs are retrieved, if you have a partner, your partner's sperm, or if you're using donor sperm, then that donor sperm is used to fertilize the eggs right away. On the pro, can get more embryos. If the donor got 20 eggs and all 20 eggs are going to be fertilized, that may result in a really high embryo number for you. On the con, you don't know what'll happen. There could be 0 eggs or 0 embryos. IVF is not a perfect science. And if you fall into that circumstance, it's too bad. You chose a fresh cycle, and that sucks. That's not common, but I've definitely seen that happen. The other thing that can happen is that egg donors are often younger, and unlike you who may be going through fertility treatment and looking at your calendar and really making sure you do everything perfect, an egg donor going through a fresh cycle, they may make a mistake. I've seen egg donors make mistakes. Of course, they're not trying to, but it often is not the number one priority in their life. So there's just a little bit more risk, although there is potentially more reward. Also, because you have to find a donor who's available, who meets your characteristics, who's ready to cycle now because you're trying to get the eggs freshly, you might have limited options, or you might have to wait if the donor you choose is busy. She's in school, can't cycle for 8 months. Are you going to wait that amount of time or go find another donor? When it comes to a frozen egg bank, the idea here is that these egg banks already put the donor through. So the donor got screened, went through the cycle, already got the eggs. So you know the eggs were retrieved. You know you don't have to wait on the donor. But then the eggs are batched into these allotments of typically 6 to 8 eggs. And then from that batch, you're essentially acquiring one batch or one cohort of eggs. Those eggs are typically shipped to your fertility clinic, thawed the day that you have a sperm sample available. They're then fertilized and grow out into a blastocyst state. Now, in both of these scenarios, you can sometimes do a synchronized transfer where you're transferring an embryo, you're trying to get the lining ready at the exact same time, or you can freeze the embryos and then set up a frozen embryo transfer. For many reasons, including the fact that embryo freezing's gotten so much better, safer, and that frozen embryo transfers really allow you to synchronize the embryo in the uterus and have the best options available. Most of the time, we're seeing a huge tendency to do frozen embryo transfers after you have embryos created. If you want to do genetic testing of the embryos, which you could still do even though they're donor eggs, you would want to proceed with a frozen transfer because the embryos would have to be biopsied, sent off to genetics, and then you'd be waiting for results before you'd want to get everything ready to transfer them. When you get eggs from a frozen egg bank, very often those eggs are going to have some guarantee, whether it's going to be 1 blastocyst or 2 blastocysts, or that they'll survive the thaw. Every egg bank has a little bit different of a guarantee. They tend to have more profiles available and less of a wait time. And due to logistics, especially after what happened with COVID, a lot of clinics have really gone almost exclusively to frozen eggs unless it is a directed donation, one of those circumstances where it's a friend or family member. And we're one of those clinics. We don't cycle egg donors who are unknown from agencies for patients for fresh donation cycles. We use frozen egg banks or we'll proceed with known donation. Egg donation tends to have a really great odds of success because these donors are young and age is such a high determinant of success. But of course, nothing is guaranteed, and I've not known any program who would guarantee you a pregnancy outcome for these. Egg donation is typically more expensive than IVF, or almost always it is. It makes sense. There's more moving parts. There's all the FDA screening. but it is often less expensive than multiple cycles of IVF. So if you're looking at your math and your odds, and you might realistically need 3 cycles of IVF to get to 1 embryo, yet 1 round of donor egg bank eggs would give you an embryo, that might make more sense to you and your family at the stage that you're at. So collectively, more expensive than IVF with your own eggs cycle to cycle, but likely need fewer cycles and have an overall higher odds of success than autologous eggs, especially if you're older or have fewer. One huge pet peeve of mine before we talk about donor embryos: there are clinics who protect their success rates, which are categorized by age, over the best interest of the patient. If you are a 30-year-old and you are running out of eggs but not out, and you only have 3 or 4 eggs available per month, you absolutely could still have a good outcome. And I have patients in that circumstance who are pregnant or who have kids. But many clinics will say they don't have a high enough egg count to meet their criteria to proceed, and that donor eggs is their only option. That is sometimes true, especially if you are out of eggs, if your FSH shows that you're in menopause, if you are no longer having periods, if you are older. Everybody does reach a threshold where that will be true. But my big red flag, if you are young, so let's say really specifically, if you're 35 and younger, and somebody is saying you need donor eggs, yet you're not an ovarian failure, you're still having cycles on your own, get another opinion. Maybe it is the right thing. I don't have all the data right here on this podcast, but you deserve to know that for sure, because I have 100% seen patients told that was their only option, and it actually wasn't, and they had more choices. Again, at the end of the day, it should be your choice to make, if at all possible. Embryo donation, I have been known to say, is the Wild West of IVF right now. And I don't mean that in a bad way. It's just so different. There are millions of embryos in storage from people who have finished their family, but who do not want to discard them. Right now, your options when you're done with your family: save your embryos, pay for them indefinitely in storage, donate them to another couple, donate them to research, donate them to clinical training in the lab. Essentially, that's it. There's nothing wrong with discarding your embryos. Totally fine. Embryos are not going to become people. They're not people now unless they get transferred into a uterus. A lot more is at stake to turn into a baby than simply an embryo in a freezer. Your body sees embryos that do not implant. If you are done with your family, you should not feel guilty or bad if your decision, the decision that's best for you, is to discard your embryos. If you don't like that option, and definitely we are always having a nuanced discussion with patients about doing IVF and your beliefs and what's important to you and how do we make IVF suit your needs the best. One option can be to try to limit the number of eggs fertilized or embryos created. And if I had a crystal ball, that would be so amazing, but I don't. And I know that IVF success increases with the number of eggs and embryos I have. If I have 3 genetically normal embryos, I can tell you there's a 95% chance that you'll have a baby from that. But if I just have 1, it's a 65% chance. Still very good. So there's strength in numbers with embryos. So you hate to do multiple cycles if you don't have to. And so this is a very complex decision. Often the exchange for I'd like to make less embryos is I will have to spend more money to potentially get to the same outcome. But you should talk to your doctor if that's how you feel. If you're on the side of you did IVF, you grew your family, you have embryos left, now you don't know what to do with them. Donating them to research or clinical lab training, these are sometimes separate or grouped together. Embryo research, very limited in the United States. Clinical lab training is really important. If you want to feel like your embryo served a purpose, helping to train the next generation of embryologists, who are the most amazing people who have to have incredible eye-hand coordination, microscopic manipulation techniques, freezing embryos, thawing embryos, biopsying embryos. They have to practice on human embryos at some point. They can't just use animal embryos. So that is a really valid, important job that those embryos could play in advancing the science. So if research sounds vague, you can always ask your lab if they're not clear about What is there training that they can be used for so that they can serve a purpose if that's important to you? And then the other option is donate them to another couple. The reason why I've said this is the Wild West is that historically, the places who were really big proponents of embryo donation were highly religious. And I have nothing against religion. Many of you know that. But I do have a problem when religion dictates medical care, because one religion shouldn't apply to everybody. And when religious entities are dictating who is worthy of receiving embryos, who is an appropriate person to be able to have a family, it doesn't sit right with me. And it doesn't sit right with a lot of people. So that's why a lot of the bigger organizations that have proceeded with embryo donation actually call it embryo adoption. And they make this whole to-do about home studies, and you must be a heterosexual couple, you must be married for X number of years, this, that. Often some requirements that are just very, very discriminatory. And then on the other end, for somebody who's going to receive their embryos, not only are they picky on who you are, if you're worthy of receiving them, you don't get knowledge about them. They've been known to transfer terrible quality embryos because they accept everything. You often don't get a say over how many are transferred, any of the characteristics. And I also just don't think that that's appropriate. You should be able, if you are somebody paying for donated embryos, paying for an embryo transfer, you shouldn't be in a position where you just show up and a doctor says, these are bad quality, so I'm putting 4 embryos in your body that are 25 years old. You deserve to have more of a role in this process. Outside of that, a lot of programs have been very locally driven. So I've worked places where there's internal structure to donate embryos with the idea that not all labs are created equal. And so I don't want to take your embryos if they suck and give them to my patients. So I'll take my own clinic's embryos, and I know they're good and trustworthy and they're created in a good lab, and then I can use those as a donor pool for my patients. However, we're really keeping the gene pool small in these circumstances. We're in one city. I'm in Austin, so at least it's kind of big. But what if these kids end up at UT together? Right? So we really want to diversify the gene pool and not be keeping donated samples, especially that are 100% genetic matches, in the same environment. So this has bothered me for a long time, and again, has not been a great answer to it. This is why we've now created Era Embryos, and you can go to eraembryos.com to learn more. This has been a labor of love, and our idea is to really make the process more medically sound, more transparent, and essentially on both sides, you can feel more comfortable in what's happening. You can donate your embryos knowing that they're going to be in a lab that's going to give them a good chance of turning into a baby, and where you can trust the process of how the clinic is run, that they're doing things by what the FDA is recommending and not making up their own rules or really manipulating patients. And also, we are prioritizing matching people who are not in the same geographic region. So if you have one of those concerns where you say, I want to donate my embryos because I want to give them a chance and I want to help somebody become a parent because that's been so life-changing for me, but I don't want that kid growing up down the street from me, at least to the best of my ability, then we are bringing in embryos from all over and matching them with patients from all over. So it really is a multi-state process, and you can feel more confident that that's something that's being paid attention to. On the receiving end, we're only accepting high-quality embryos. If they are not good embryos, if I wouldn't transfer it into one of my Fora patients, we are super picky, not taking it. So we're only taking high-quality embryos. We're taking embryos that have been properly evaluated and tested, that we've got the right data on, and we're crafting a donor bank that is really reflective of what's important as a recipient and knowing that you're going to have the best medical care that you can get. All recipients will be traveling to Austin to get their embryo transfer. So the embryos might be coming from all over, but they will be coming here. You can be a patient from anywhere if you want to receive embryos, but you will come visit the best city in the country. Nobody's going to complain about coming to Austin for a little bit of a visit for your embryo transfer, but you will come here for that. So this is something that we've been really working on, crafting the outline, getting the staffing, getting the structure, making sure we've got all the safeguards in place so that we can really craft that first of its kind program to really bridge the gap in this huge need. There are patients who have such a hard time, and we don't always know why. And we're really left with egg quality, sperm quality. Maybe it's age, maybe it's not. And if you are in that circumstance saying, gosh, IVF's already so expensive, egg donation costs even more than IVF, embryo donation costs less, as it should. A lot of the cost has already been spent. These embryos have already been created and tested. Yes, there's some cost because we've got to get them shipped here. We've got to do some screening, got to do an embryo transfer, but it is by far really priced at such a lower price point that it's opening up and expanding parenthood opportunities to people I know who are going to be amazing parents. And maybe they look at the cost of egg donation and that feels really, really high. Or for people who potentially are in a double donor situation where you might need an egg donor and a sperm donor, then this might just make more sense for you. There's embryos that need good homes, and this is an opportunity for you to give one of those embryos a home. No matter what, there's no right or wrong choice. I will say if you're looking at either donating your embryos or receiving them, some of those red flag warning signs I talked about are really, really out there. Meaning, what are the selection criteria? How are they verifying that they're taking good care? Making sure that things are scientifically sound, that you're having the highest chance of success, and that they're diversifying the gene pool with still giving patients autonomy and choosing what's right for their family. So if you want to learn more, eraembryos.com, whether that is you'd like to donate your embryos or whether you want to try to learn more about receiving embryos, embryo adoption, even though it's commonly used, is not the appropriate medical term. We should use embryo donation. And then lastly, in order to receive donor eggs or donor embryos, if the plan is for you to have an embryo transfer, we've got to make sure you can have an embryo transfer. There are upper limits in age for embryo transfers. ASRM says up to age 54, 55. So that's what a lot of clinics use. Of course, to meet that criteria, you often do have to have other medical evaluation, especially if you're over age 50. That might include a cardiac evaluation. That might include an echocardiogram of your heart. It might include an MFM or high-risk OB consult. Every clinic will kind of have their outline. You'll have to get an evaluation of your uterus to make sure everything looks good to prepare for the embryo transfer. And you'll have to have infectious disease testing. You'll have to meet with a reproductive psychologist to just talk through donor selection and raising a donor-conceived child. We don't believe in hiding. We want to be transparent. Ultimately, you're the parent and you need to be armed with information for how you want to choose a donor and how you want to raise this child and discuss their conception story. And then from there, you will proceed with a frozen embryo transfer, getting the uterus ready, taking estrogen, doing ultrasound, getting progesterone. You can still carry a baby even if you're an ovarian failure. Important concept, because a medicated cycle giving you estrogen overrides that normal process. So that's not something you have to worry about. Last thing I want to say is that I've seen so many people matching with egg or embryo donors on the internet, in Facebook groups, in Reddit forums, on Instagram or TikTok. And yes, maybe that's an incredible story, but truly, buyer beware. The reason why there's certain safeguards in place, I would love to not follow all these rules and regulations by the FDA. But at the end of the day, the reason why we have policies and protocols is because I want you to have the family you deserve, and I don't want that to be legally challenged, and I don't want you to have a sick child that maybe we could have prevented. So if you are going about this outside the normal medical world, please listen if your clinic is recommending certain types of testing or screening, and don't be so resistant to it just in the sake of saving money. Because what we're really trying to do is help you grow your family, and we are all on the same page. This is a much bigger concept than we can really cover in just one episode, but this was just a start to egg and embryo donation and a huge introduction to Era Embryos, which I am so excited to introduce the world to this project that we've been working on for years. So you can head to eraembryos.com to learn more. As always, I appreciate you guys. Ask your questions so that we can do some follow-ups, dive into these topics even deeper. You can always ask questions on Natalie Crawford MD, Instagram on Mondays, and sign up for the newsletter at nataliecrawfordmd.com/newsletter. Don't forget to check out the YouTube channel, and thank you, friends. Thank you all for listening to As a Woman. It would mean so much if you could rate, review, and follow the podcast to be notified of new episodes every Sunday. I hope you learned something new, and I hope you share it with someone in your life. Be sure to follow along on Instagram at nataliecrawfordmd and check out the YouTube channel Natalie Crawford MD. If you're interested in becoming a patient, you can also follow Fora Fertility. I'm so thrilled to have you here, part of the community that amplifies others as a woman.